went to my first physical therapy for my arm, and I'm never going back there again.
Why?
Because, all right, so I've got two things going on. I'm self-motivated. I don't need to, every time I've joined a gym, I've never needed the person to show me what to do. I mean, I do it because it's free. Like the very first training session's always free and they evaluate you, but then they try to get you sign up for sessions.
Mm-hmm.
I'm motivated. I will go to a gym. I know what to do when I'm there. I don't got to pay a guy $100 to tell me squat and run and pick that up and put that down. I'm good on my own. So it's the same thing with physical therapy. I have tennis elbow. I haven't played tennis in years, but which is ironic because remember we live near a tennis court and you dared me to play tennis.
And you never played tennis. And
right.
You never. And I told you wouldn't play tennis. And you fought with me and you never played tennis. And now you have tennis elbow.
And now I have tennis elbow.
That's like me getting runner knee.
Right. Exactly. You who doesn't leave the car or the couch.
Right. Golfer's wrist,
right.
Something like this. It makes no sense why you have this.
Right. I got it from helping my mother move. I was picking up boxes that were way too heavy and I injured myself and it was stupid. It'll go away on its own. It's not a big deal. I've only had it for like a month. It's not like this is something that's been recurring for years. This is brand new. But when you go see a doctor, they send you to physical therapy. So I walk into the physical therapy place and it's basically like a street level office, which physical therapy should be street level. I'm sorry. Like if you're in there for like a leg or something like that,
right.
You definitely don't need to be climbing upstairs or worrying about. So that part's good.
Mm-hmm.
But it looks like a small real estate office and there's 4 desks and you do your physical therapy behind a desk with a physical therapist. Now, 2 of the desks have those big giant lucite things like as if you're at the bank so that the therapist is on one side, you're on the other and you slip your arm through and they do whatever they're going to do to you, But for the most part, I felt like, okay, it was too small a space. There were too many people there. I don't need to expose myself to COVID to have a woman hand me a 1-pound weight and say, lift this.
Mm-hmm.
I can go get myself a 1-pound weight at Target and go home and just lift that. So I didn't really need to be there exposing myself to COVID. So there was that. And then they give you all the exercises on a sheet of paper. I could just do it myself. Why I got to be there?
There's got to be a YouTube video on how to work out tennis elbow at home.
Right. Yeah, there definitely
There's got to
is.
be.
I don't even need it because now I have the sheet of paper and they gave me like this armband thing that I have to wear. So put that on, and then I just like lift some weights at home, which I have a set of weights. I can certainly do that myself. So yeah. And they're like, make sure you ice it. You can come in, you can ice it here. It's like, why would I come in, expose myself to COVID for you to ice my arm?
Yeah.
I
got
lay
ice
in
at
bed.
Exercises for lateral epicondylalgia, also known as tennis elbow.
Mm-hmm. See, this guy tells you how to work it out at home.
Ooh, and the music is sexy.
Now, link is in the video description.
And he's got an accent, and you
welcome
can
back
look
to
at him.
Tutors.
Nice.
Although the course of lateral epicondylalgia is favorable, with 89% of patients reporting improvement in pain,
And all of them females over the age of 30.
a randomized controlled trial by Peterson et al. In the year 2011 has shown superior outcomes regarding pain.
I'm not going to get a weight. I'm going to get a vibrator. He sounds hot.
At 3 months follow-up. Currently, there is no common consensus.
Can you just mute it? I don't need to listen to him.
Modality.
No, what I'm saying is you don't have to catch COVID and die. You can stay at home.
Quiet. I'm busy looking at this guy now.
Generally seems to decrease pain and tendinopathy.
Yes.
Coombs et al. In the year 2016 have shown
Thank you
an
for this,
increase
Anthony.
in pain intensity
I feel better already.
after an acute bout of isometric exercise performed at an intensity
See,
above,
this is much
but
better
not
than the
below
lady across the
individual
table telling
pain
you
threshold.
to lift weights.
So while
Exactly.
isometric exercise
And that's the
might
weird
still
thing
have
about it. It's like you should walk in there
included.
and they should say, "What are you doing
Number
here?
one, wrist
Go
extensions.
home and get on
Have
YouTube."
your
See,
patient
here you
sit
go.
with the forearm in pronation and supported on his thigh or any other surface.
Yeah, see?
The elbow should be flexed to around
You can do this at home. You don't have to go, okay, I don't think anything is going to trump COVID right now. I don't care
Right.
if your arm is almost ready to fall off. I don't think you should go somewhere and sit in a room full of the COVID disease.
Yeah, the thing about it was, so I sat all the way in the back by myself behind this Lucite thing. So I was really far away from people, but I noticed they were all like congregating around this one table and they were laughing and telling jokes and having fun. And everybody had masks on, but it's a mask, not an iron lung. You know, they're not 100%. And they're like laughing and breathing on each other and whatever. And I was like, I don't need to be here. And they're supposed to take your temperature when you walk in. And the first time I walked in, she didn't do it. And the second time I walked in, then she remembered to take my temperature. It's like, okay, you're not even careful.
Yeah, you could have had the COVID when you walked in, and then they wouldn't know.
Right. I could have given the COVID yesterday, and then today came back, and we could have traded COVIDs.
Nice. So,
Yeah, I'm not going back.
don't go back. Just watch it on YouTube. Watch that guy that talks like
Thank you.
that.
I'm definitely going to watch that guy.
Watch that guy. He'll tell you how to make your elbow feel better, and then you don't have to go somewhere and die.
Yeah, I already feel better just listening to his voice.
But on the other hand, you doing any type of physical labor, like helping your mom move, I could have told you you're going to hurt yourself. I knew that before it even happened.
Yeah. You know, and she said those boxes are way too heavy. I'm like, don't worry, I got it. You know, because I think I'm like superhuman. I had no trouble picking up these big, heavy boxes. And in the moment, I was great. In the moment, I was like, look at me carrying these boxes.
It's drama no matter what. You're going to have drama.